welcome. It is such an honor to have all of you here today. Thank you for taking time to be with us. My job this morning is to tell you a little bit about health technology, about how health technology is shaping our work at the American Heart Association, and also to bring you up to date on some exciting news about some new directions that we're taking at the AHA in the area of technology. And I want to do that by framing these comments around the fact that there is, in our belief, an intersection between technology, innovation, and values. And we start with the recognition, of course, that technology is changing everything, and this group knows better than anyone, just how much technology has changed the world, and how many of the 7.5 billion people on the face of this earth, how many of them are using technology today versus a year ago, 3 years ago, or 5 years ago, and how important not just technology solutions are to health and well-being, but how important social media is to health and well-being, and how we can all think about, utilizing those channels as a way to help us achieve our goals of creating a healthier world. And boy, do we need to, because cardiovascular diseases and all diseases continue to really dominate and create enormous problems for people in this country and around the world. Hopefully all of you know that 17.5 million people in the world lose their lives every year to cardiovascular diseases, but so many more people are suffering from the diseases that we at the American Heart Association care deeply about. And we recognize that the onset of new types of risk for people, new meaning in the past 10 years, overweight, obesity, type 2 diabetes are creating even more cardiovascular diseases and stroke. And as a matter of fact, here in the United States, after 40 consecutive years of reduction of deaths from cardiovascular diseases, the last 2 years we have seen an uptick in deaths, and that is quite alarming to us. And we recognize how important it is that we marshal all of the resources we can to solve this problem. In terms of speaking of values, for some of you, you work closely with the AHA, and for others of you, you're beginning to work closely with the AHA. And one thing I want to make sure you are aware of is that the AHA, from top to bottom, is dedicated to and lives by these guiding values. And these guiding values are very important as we think about the impact of our work, whether it's through technology, in communities, in our scientific enterprise. And I'm going to read these to you because they have very significant meaning to our work, and I hope that they will have meaning to your work as well. We want to meet people where they are. We want to improve and extend people's lives. We want to speak with a trustworthy voice. We want to bring science to life. We want to inspire passionate commitment. We want to make an extraordinary impact. We want to ensure equitable health for all, and we want to build powerful partnerships, which are, of course, the partnerships that we have with so many of you. And these guiding values have really helped us think about our role in health and health technology. And one thing we recognize is that what people, consumers, want, both in the US and around the world, at the end of the day, is they want to live a healthy lifestyle without disease or risk, and they want to be able to have as much time as possible to spend their moments with their loved ones doing the things that matter most in their life. And that's why this organization has been dedicated to helping people manage their risk. It's why back in 2010 we created the first ever definition of ideal cardiovascular health that allows us to drill in very specifically on the things that are causing this increased cardiovascular disease and stroke in this country. And we also know that the American Heart Association can do this work by making sure that we are bringing the best of what we have to very significant areas of change that can impact lives. And so the association is focused broadly, I would say, on 5 things: changing policy, leading breakthroughs in science and technology, changing systems, transforming healthcare, and transforming communities. And the dedication of the association to take all of our resources to make these possible is why we bring all of you here together today, because we know without question that there is no way any organization, any singular organization, can work to affect these changes by themselves. Another thing that's important, I hope that you are aware, but if you're not, is that the American Heart Association is not just a US-based organization. We are dedicated to those core values and the pillars of our work in the US and around the world. And as a matter of fact, we have a presence in 80 countries, largely through our emergency cardiovascular care and resuscitation program, but this portfolio is expanding broadly. And we see that technologies will be a way that the association can continue to expand its work in these global markets. You know, last night I was listening to Alex and Dr. McRae talk about One Brave Idea. And, you know, when we think about our work in technology, one of the things we're trying to do is to fix an information problem. And because we really believe at the end of the day, why are people suffering? Why is science not accelerating as quickly? Why are people not managing their risk? At the end of the day, it's an information problem. And how can we do what we do better to create more organized, more relevant information for all of the stakeholders of the association? And so a few things, I was asked to highlight just a couple of things that you won't otherwise hear about today. A few of the things that we're doing that have technology at the center include our work in the Institute for Precision Cardiovascular Medicine, an institute that we created 3 years ago to help make sure that there were more precise treatments for patients at the moment of their greatest need. And a few of the things that the AHA has done and will be doing in the Institute for Precision Cardiovascular Medicine are all about technology and engagement. With Amazon, the AHA has created a state-of-the-art technology platform that will take away the barrier of data sharing. This, if you think of, I don't know how many of you get boxes at your house every day from Amazon. I bet many of you do. And if you think about how Amazon has created a marketplace for buying goods and services, in essence, what we've created with Amazon is a marketplace for data, where clinical trials, data from the government, data from longitudinal studies, data from international cardiovascular consortia can all be made available in one place for scientists and consumers and anyone who's interested to search among and across studies. And this, for those of you who do science as a career, and there's many of you in the audience, one of the biggest barriers is having access to other people's data. And we're so proud that after announcing this in November and doing a lot of user experience testing and beta testing, that in July, when the site went live, we already have 36.5 million pieces of data available for scientists on this platform that we've created with Amazon. And that's one way that we intend to break down the barrier and to help with the acceleration of science and technology. You heard about One Brave Idea last night from Callum. I might also mention that the AHA has created a patient-powered research network that's focused on allowing individuals to contribute their data. And again, with Amazon and with the Broad Institute, the American Heart Association is very dedicated to collecting, you know, very deep data on people, but also very light data on people. We recognize how little we know about diet and physical activity, and how if we could get people to give their data to a trusted broker like the American Heart Association, maybe we could find new solutions. And we're doing the same, and I'll just tease this because in November we'll be announcing a wonderful new partnership that will put the American Heart Association at the center of accelerating drug discovery in cardiovascular diseases. So stay tuned for more information on that. We also are focused on improving care for people who suffer a sudden cardiac arrest through our traditional work in emergency cardiovascular care and CPR, but through a new technology solution that we have created and are rolling out in healthcare institutions here in the United States called Resuscitation Quality Improvement, where we're bringing the training right to the hospital floor, and where we are testing skills on a quarter quarterly basis using technology and helping people understand their accuracy in performing CPR that can save someone's life. And we have a goal through our Resuscitation Quality Improvement Program of not only enabling healthcare providers to provide high-quality CPR, but also to make sure that we can do our part to save more lives, including our goal of saving 50,000 lives through resuscitation quality improvement. And also, the HA is very proud that we work in companies throughout America to provide health solutions. And we are using one of the most important assets we have at the HA, which is the brand of the HA, to help recognize those companies who are doing all the right things in terms of not just providing an atmosphere for health for their employees, but actually demonstrating improved health through biometric data of employees in the workplace. And this year we launched and were able to recognize over 1,000 companies who are able to do this really well. And we intend to use the grassroots network of the HA to expand this even more broadly in the future. And again, at the center of this is a technology solution that allows individuals to know and manage their risk for cardiovascular disease, and for companies to understand the aggregate risk of their employees and whether it's going up or down. And we power these relationships with the content and care plans and other technology solutions of the American Heart Association in companies throughout the country and actually soon throughout the world. But I now want to focus on this point about values. You know, as we sit in meetings like this, it's very easy for all of us to get excited about a wonderful new solution in technology or something that we are creating that we're interested in commercializing and selling into the marketplace. And all of that is important. It's why, you know, technologies have come so far in terms of helping us manage disease and provide new solutions in new and better ways. But our point of view is that we've got to be more concerned about how technologies can help us eliminate health disparities. And we know, I'm sure all of you do as well, that there are many social determinants of health, things that ultimately will help or hurt individuals as it relates to their overall health and well-being. Things like economic stability, education, societal influences, neighborhood environments. And the truth of the matter is, so many people in this country do not have the same access to environments, health, and health care that allow them to live a full and happy life. And the question for all of you is, are the technologies you're creating going to add to that problem, or are they going to fix that problem? And we would challenge all of you to think about how your technologies can help fix this problem. We recognize globally that there is a huge inequity of health in this world. The American Heart Association is actively involved globally, not just for our own business interests, but with organizations like the World Health Organization, thinking about the burden of non-communicable diseases. And you know, the fact that in the world there is still such a discrepancy of life and longevity is something we all need to think about. And even here in the United States, you know, the fact that you can live a mile apart from somebody in, you know, pick it, Philadelphia, you know, if you live in the inner city of Philadelphia versus the next train stop, there could be a 20-year difference in life expectancy. And the people in those communities that don't have the same life expectancy don't have access to the stuff that all of you are creating. And so how are we going to fix this problem? We know that at the end of it, what we believe is technology really is at the nexus of hope and fear. You know, it's hopeful that we can create new solutions, but boy, you know, can there be fear as we think about technology? You know, thinking about the internet is a great example of this. You know, when the internet was created by whoever created it, Al Gore or whoever, you know, created it back in the day, you know, the whole goal of creating the internet was to make information available to everybody. You know, information was going to be available to everybody, and organizations like Google helped create the encyclopedia of information, so it's available to anybody at any moment through searchable technologies. But now look what's happened with the internet. cyber attacks, bullying, you know, all of these things that have become such negative social influences that we have to pay attention to the fact that these solutions we're creating need to provide the hope of technology, the wonderful things about technology, the access at any moment, any time, to give people the tools to change and manage their health and well-being, to give doctors and hospitals the tools to manage their health and well-being, to inspire new partnerships and collaborations in science, and to create new solutions that will allow science to accelerate more quickly so we can ultimately have better outcomes for patients. But I have to say, you know, we think as much about the fear of technology and how technology can divide people instead of bring people together. And, you know, as an organization, we want to work with all of you to help think about not just, you know, the best way to use data or the most robust way to use applications, but how we do it in a way that both is accessible to every person as well as is safe and protects the very things that matter most to people, their information, their health, and their life. So at the end, to summarize that comment, we want to focus on technology for the many, not just the few. And that's why we have been working very closely with the World Economic Forum. And the World Economic Forum has done a wonderful job, I think, of reminding us how technology has changed our lives over many, many, many decades and centuries. You know, if you think about how long it took for the first industrial revolution, where things like, you know, steam engines and other kinds of things came, to the second industrial revolution, where there was mass production and electrical energy that totally changed the way people lived, to the third industrial revolutions, where we had TVs and radios and recorders, you know, only back in 1969, to today. How quickly the world is changing with all the stuff we're talking about today: AI, data, big data, new ways of providing solutions to consumers. And the pace of this technology change has never been faster. And that's why the World Economic Forum and its founder, Dr. Klaus Schwab, has talked about the fact that we often hear people talk about the concept of Uberization, where a new technology completely turns an industry on its head. No industry will remain untouched by these forces of technology. And we are delighted to announce today that because of our commitment to health and access to health for all people, and our commitment to make sure that the American Heart Association is at the leading edge and is a leading voice of thinking about these issues and sorting through these issues, I'm very proud to announce today that the American Heart Association has joined with the World Economic Forum to be a leading partner in the new Center for the Fourth Industrial Revolution that is opening in San Francisco. This Center for the Fourth Industrial Revolution is going to help assure that there is dialogue and that there are solutions for very critical problems that will help this world decide if this technology is for good or if this technology creates more problems in the world. And very specifically, the Center for the Fourth Industrial Revolution will be focusing on these 9 areas: accelerating innovation in production for small and medium enterprises, artificial intelligence and machine learning, autonomous vehicles, blockchain, digital trade and cross-border data flows, the future of drones and tomorrow's airspace, the Internet of Things and connected devices, a new vision for the ocean when we think about water and how, you know, and on any given day, 50% of the world's population in 1 month goes without water for 1 month of the year. That is a fact that's startling. And of course, precision medicine. And as a leading sponsor of the World Economic Center for the Fourth Industrial Revolution, along with great organizations like Salesforce, Intel, and Kaiser Permanente, the AHA very specifically will be focusing its resources and our time in helping think through global solutions around artificial intelligence and machine learning, the Internet of Things and connected devices, devices, and of course, precision medicine. And we really will welcome all of your input over time, and certainly will involve many of you in helping us think through how we at the AHA can continue to provide solutions, not just in the form of products and services and using our brand and our network to help make technologies available to individuals, but how we can really help make sure that this world has solutions to things that could either be an advantage for all or a disadvantage for all. And at the end, we are all on this planet together, and so we say, let's do something good for all.